Now I've been joined by Additional Commissioner of BMC, Mr. Suresh Kanani. Sir, today the task force held its meeting regarding the vaccine issue. How basically BMC is planning to distribute this vaccine and store this vaccine?
We have decided in detail in the first task force committee meeting. We have prepared the blueprint, and as per that blueprint, it has been divided into 5 different sections. The first one is storage. So we have adequate storage facility available with us in the medical college hospitals, and we are also developing one more facility in Kanjurmarg area. It would be ready by this month end. So it will take care of the entire storage capacity of the vaccine. Then transportation plan, we also discuss about the transportation plan, how the vaccine would taken to the respective vaccination centers.
Okay.
And we have finalized the transportation plan from both the centers, from the temporary centers and from the permanent centers. And for that, we may require the cold storage boxes. So we have adequate boxes available with us, which would be maintaining temperature on the lines of the cold storage. And then vaccination center, we also have identified vaccination center. To start with, we have identified 8 vaccination centers for the healthcare workers, 4 medical college hospitals and 4 peripheral hospitals, 2 in eastern suburb and 2 in western suburb. Then the manpower, we have identified the manpower and we have given the initial training to them. The detailed training would be followed after receiving the detailed guidelines or the WAP from Government of India.
So main question here is that who will be getting this vaccine first?
The healthcare workers, because as per the guidelines given to us by Government of India, this vaccine will be given to the healthcare workers, and we have collected data of all the healthcare workers involved in the COVID fight in the various hospitals, and this data is around 1.25 lakh, and we are trying to cover it within 10 to 15 days. So for the first dose is concerned, and second dose will also take an equal amount of time for administering this vaccine.
How we are going to ensure that the black marketing will not take place? Because during the pandemic, we saw that for the remdesivir or any other life-saving medicine, there was a lot of black marketing which was happening. So how we are going to ensure this time?
So we have, doing this thing on our own without involving any third party as of now. So the entire vaccination program will be controlled by municipal corporation, and the chances of getting some complaints or someone is siphoning the vaccine are very, very less. But with each party, we are keeping one security personnel as well, so that he will also act as a vigilant officer, and in case something goes wrong, he will report back to us.
If we talk about the team which will be basically distributing, or we can say will be involved in this entire process, how big is this team, and how many people would be there who will be getting this particular specialized training to distribute this vaccine and to give this dose?
Yeah, as of now, we have decided to have 500 teams. Each team would have 5 members. One would be the vaccinator, another would be the identifier, third one and fourth one would be the support staff, and fifth one would be of the security personnel. So that entire team would be having the 5 person, and we have identified them. We have given the preliminary training, and subsequent detailed training will be given in due course of time.
As you said that BMC has already identified the storage place. What if we require more storage places, or what exactly is the plan of the BMC? If we require more storage places, do we have that much capacity?
Yes, certainly we have that much capacity, because the temporary storage space, if you ask me about the 4 medical college, we can store around 2 lakh vaccine to start with. And the facility which we are developing in the Kanjurmarg area, right now we are transforming only 1 floor. So 2 floor also available with us. In case of need, we can transform the remaining 2 floor in the storage facility. But we feel that 1 floor would be more than enough for accommodating the vaccine which are being provided to us by Government of India.
Maharashtra CM in his one of the address on the social media said that this particular vaccine first dose has to be followed by the booster dose. So how we are going to manage that booster dose also, because as you said, it will be quite of a long period to distribute this vaccine.
Yeah, depending on the type of vaccine, after 21 days the second dose is to be given. In some of the vaccine it is 28 days. This period is 28 days. So once the period gets over, the person would automatically be intimated that yes, he is required to go to the particular place for getting the second dose of vaccine. So we'll follow the same protocol for this as well.
Thank you, sir. Thank you.